Hello all, I'm Shamla. I'm doing fellowship in contact lens dispensing under Indian Academy of Optometry. Here in this video, I'm gonna demonstrate the insertion and the removal of the soft contact lens. Let's start the video.
Here I am using cosmetic contact lens in the shade of hazel. Now, first thing is you need to wash your hands. Lots of microorganisms can be live on your hands. Make sure you clean all those off, otherwise it goes to infection to eyes. Then you need to dry your hands thoroughly with a lint-free towel. It is best to start with right or dominant eye. Open blisters pack. Use the padding of your pointing finger to pick up the lens. Bring careful without any damage to lens. Always clean the lens before insertion and after removal of the lens. Place the lens in the palm of your hand. Pour solution to the lens. Rub lens gently with the index finger for few seconds. Before position of contact lens to the eye, inspect the lens for any sort of defect or inside out. This part is really important for having good comfort in your eyes. Soft lenses can be inside out. To check if the lens is correct way or it inside out. Deco test is performed by place the lens in your palm and squeeze the lens, or it can be performed by place the lens at the tip of index finger and thumb, then pinch it out. After that, place the contact lens at the tip of index finger. Look at it from side. If the lens are in correct way, it should be look like perfectly bowed. If the lens is inside out, lens shallower and more pointed at edges. Insertion of contact lens. Use dominant hand middle finger with the lens on pointer finger and hold the lower eyelid with middle finger. With the non-dominant hand of middle finger to hold the upper eyelid at very top edge of the lid. Hold it to the orbital bone. Just put the lens directly onto the sclera or white portion. Then move the eyes until its lens goes to settle to cornea. Massage the eye gently. Repeat same procedure to other eye. Movement and coverage. Corneal coverage. With the eye in primary position, the lens should show full corneal coverage about 1 mm to 2 mm beyond the limbus before and after blink. If the coverage is more than 2 mm, lens diameter is too large. If the cornea is not fully covered, means the lens diameter need to be increased. Edge alignment. The edge of the lens should be observed with the reference to the conjunctiva. If the edge is sliding smoothly and aligning with the conjunctiva, it is correct. If the lens edge is indented onto the cornea, the lens is tight. If it stands off, the lens is loose. Lens movement. It is most important evaluation technique. Movement of the lens is essential for the proper tear exchange and the removal of debris. Inadequate movement will lead to inflammation, edema and red eye. Push-up test is performed to find the lens movement. Look straight and push the lens up vertically through the pressure on lower lid. In ideal fit, lens movement 1 mm to 2 mm move up and smoothly recentered. In tight fit, lens resist any movement. In loose fit, lens will slide off easily, may not be recentered correctly. Lens centration. Lens extending equal distance beyond limbus in all directions. Optical center of the lens coincide with the center of the pupil. Centered in all position of gaze. Next step is removing of contact lens. Before removing of contact lens, make sure you wash your hand properly. Pinching technique is using for the removal of the contact lens. Hold the lower lid and the third finger of one hand. Touch the lens with the index finger of the hand and slide the lens. Pinch the lens gently with the thumb and index finger and remove the lens. Always make sure to clean the lens after removal and put the lens back to case with solution. Here I am using disposable contact lens so it can be disposed.